What tools could actually support our employee caregivers? We've talked about culture, policy, flexibility, but when push comes to shove, people ask, what will actually help? Because no one wants another benefit that's hard to use or buried in fine print. The difference between support that feels like lip service and support that feels real lies in the tools, the systems, the platforms, the processes that makes assistance usable in real life. So in this video, we're going to explore what those tools could look like, what works, what doesn't, and how to pick the ones that your team will actually use. If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. Over time, I've seen companies roll out excellent policies that never landed because no one made them usable. Policies are promises, but tools are bridges. With the right tool set, your most well-intended supports can stay invisible, underused, or burdensome. Support becomes real when tools centralize access, automate tasks, reduce friction, connect people to resources. These are the things that you want. So let's walk through the different tool categories that can often make the difference. The first category are platforms that coordinate care. At the heart of caregiver support is coordination, helping with scheduling, tracking, and communication. One example application for this is a program called CareLoop. It offers a case management portal plus coaching and resource matching. Employees can upload care tasks and manage documents and get guidance all in one place. Such platforms can help reduce the mental load of managing care because employees don't have to hack together spreadsheets and emails and sticky notes. They also let you see, what are they stressed with? Where are the gaps? When you're selecting a platform for your employees as part of your benefits, ensure that it's secure, privacy aware, it's mobile friendly, and look for features like case management or coaching options. See if it can integrate with your HR or benefits system. The second category are toolkits, guides, and resource directories. Sometimes the simplest tools are the most powerful. You can create or share caregiver toolkits, which are curated resource collections that can guide employees on care planning or legal questions or financial help, respite options. Many organizations will partner with external toolkits, such as those developed by AARP, for example. The third category are flexibility or scheduling software. Flexibility only works when you can see it, manage it, and coordinate it. So you want to look for scheduling tools for your whole team that looks for ways to allow for donut schedules or holes in the day, availability for swapping shifts if needed, or job share, and visibility across the team so that you can plan for coverage in the future as well as right now. When your tools are integrated with your policies, then you can approve or suggest adjustments quickly without the chaos. The fourth category of tools are backup care or respite networks. Some tools aren't software, they are services. Offering access to backup care or respite services can be one of the most tangible support tools for caregivers. Respite care gives caregivers a break, planned or unplanned, and keeps them from tapping out. Your organization could partner with a local provider or build a vendor network or contract on-demand providers as part of those benefits. The key is it should be easy to book, simple to get eligibility for, transparent in terms of the cost for the individual, as well as have backup options across geography and type, childcare, elder care, etc. The more seamless you make it, the more they will trust it and use it when they need it. Tool category number 5 are analytics and dashboards. A tool that doesn't tell you anything is a nice toy. What moves the needle is visibility. So you want to be able to track how often are these platforms, these tools being used. Are they being used frequently? What type of categories are being used? Are they the resources, scheduling, or respite? You want to look for what is the most helpful and what is being underutilized. Let's put it all together. Imagine a caregiver support system built like this. Upon eligibility, they receive a link to a portal. They sign in, they enter care tasks, they connect with a resource coach, and they browse a toolkit. They request flexible scheduling through the app, and as soon as disruption hits, if they need backup care, they're able to schedule that through the same platform. And meanwhile, you as a manager or as a leader or as HR, you can see a dashboard showing anonymized data, looking at usage gaps and patterns. That's an integrated experience, real support, because the employee doesn't need 5 separate systems, 5 separate platforms. If you're looking for a way to build these sort of systems, a system for your workplace, then join me in my free workshop, The Future of Work is Care. And if you haven't checked out my book, Workplaces That Care, be sure to pick it up on Amazon. It is your playbook for building resilient workplaces that support and retain caregiving employees. Next, we're going to talk about why supporting caregivers isn't just the right thing, it's a retention powerhouse. Remember, in this age of AI, the future of work is still human. Let's create workplaces that care.